to invite Professor Muneer Amanullah on the stage for presenting the last lecture of the day. And he's also, you're not lecturing, no? No, just no. So I think that would mean we will probably be sort of going fast forward towards our lunch. So let's hear the concluding remarks.
Thank you very much, Hafiz. Thank you for the promotion as well. I'm just been promoted to professor by him. I'm still an associate, as far as I know. So, absolutely fascinating session we have had, and whatever comments have come, they have been all supportive, intriguing, provocative, and sometimes angry. But I think what we have to understand is that this is going to happen. No, sorry, I want to rephrase that. This has already happened. We have to embrace it, and we have to move forward. We have had some excellent presentations. Mr. Law, he talked about his medical apps and how we can work towards developing high quality, user-friendly, effective, and reproducible apps. And the main aim should always be better patient care, but it will always come and only come if there is awareness amongst the doctors that these type of applications are available. The questions raised multiple times were legislation, regulation, patient's confidentiality, but all that will be taken care of over time. This is an evolving speciality. It is a speciality and it's evolving, and these aspects would be answered in due course of time. Sohail presented his dream child of a healthcare city and the effect he's going to have and impact he's going to have in the underdeveloped and under-resourced countries, Pakistan being one of them, would be immense. All of us, I think, present in the room should register with this health city so that we can give our 2 bits to the society back. Dr. Ahmed, it was an eye-opener that a pharmaceutical company could do something without money involved and give it back to the society and the doctors. But that is what is happening. I think more and more organizations are realizing the importance of giving back to the society rather than just making money out of us. Again, the question was raised about patient confidentiality, and like I said, alluded to earlier, that it is going to be taken care of. Dr. Faisal Salim talked about the limited resources in Wana, but there are multiple thousands of villages like that, or even worse. At least they had a army settlement there with the facilities. There are some villages which don't have any. And I think it's about time that we realized as a unit, as a country, as a society, that we owe it to them. And we need to develop a project through the APPS with collaborating with units within the country and delivering what needs to be delivered. But all said and done, Dr. Salim, hats off to you for sticking around in that area and not only taking care of the soldiers and their families, but also actually enjoying your life over there. And then finally, forward, that is what we need to do, move forward, and thank you to the 2 young girls. I think this is what is going to happen. We are going to have doctors who are going to be entrepreneurs, and they're going to be much richer than we are ever going to be. And I wish I was born in the millennium, but sadly I'm not. But all said and done, I think this probably, if I may say so, was the best session we have had so far. This is going to be the way forward. There is no do things about it. We just have to embrace it and make sure that we make the most of it. Thank you very much.